Thank you for taking the time to spend some time with us and report on this story. I want to start by saying the Delta variant is a game changer. It's a killer. It's going to make a lot of people sick. There's an article in Newsweek where a doctor who knows viruses predicts that every single unvaccinated person should expect to be hit by the Delta variant. The reality is we're a learning community, and we work together in that regard to keep one another safe. And in that regard, we have decided, because of the Delta variant, that we needed to expedite our requirement of all students who would use our campus facilities for their education to be vaccinated, and to have begun that process by August 20th. If they wish to continue those activities with respect to our campuses and in receiving their education on those campuses or at facilities and centers run by universities within our constellation. This is a serious decision, one which a month ago we would not have even envisioned having to make. But in 1 month's time, we have watched the numbers of cases here in Maine increase, actually in the last 2 weeks, dramatically. We've gone from an average in the low 20s to as many as 126 people ill and in hospitals. Let me remind you that we make this decision in circumstances that are far worse than when we originally closed our universities to in-person learning. At that time, there were 0 cases, but we knew they were coming. In this case, we know that Delta is likely to get worse and get worse quickly and infect more people, and therefore allow more people to transmit that disease onto others. So with a vaccine that has now been used over 160 million times in our nation, and vaccines that have been used many other millions of times in other countries, that the time has come that we must, by necessity, require our students to be vaccinated. Also reaching out to the labor organizations that represent our workforce in the hopes that we will shortly have a similar requirement in hand after those discussions. This is a serious decision. It's one that's based on public health and on the science that presents itself. And we are responding to that public health emergency and the science that dictates our action. With that, I don't know how we go on from here. Dan, do you want to take questions, or should I call on the presidents?
Let's speak with our presidents, beginning with President Freeney Mundy, who chairs the UMS Science Advisory Board and the Vaccination Planning and Partnership Task Force.
Thank you, Dan. Thank you, Chancellor. Good afternoon, everybody. It is wonderful to see you. And we are pleased to be at this point in so many ways with this decision. I want to say that our communities through these past 16 months have been phenomenal. They have put as a priority to care for one another, to pay attention to our collective health, and to be flexible through a very difficult pandemic that is ever changing, as the Chancellor has described. These most recent statistics about the Delta variant and what we may need to expect from it are really alarming. And so to decide that we will take a public health stance that is meant to protect all of our community members as best we know how to do at this moment with our data in hand and with the science behind it. It's an important decision, a serious decision, as the Chancellor said, and one that we have confidence in as a means of moving forward and keeping our system going into the fall with the safest possible conditions.
Thank you, President Freeney Mundy. President Deb Hedin from the University of Maine at Fort Kent.
Hi, we so much appreciate this opportunity to share this important news with you. And we care about the health and the safety of our campus communities. And therefore, this is the right decision at the right time so that all students can be well prepared to return to campus fully vaccinated, or at least partially vaccinated at the start, in order to have a safe semester. Thank you.
President Ray Rice from the University of Maine at Presque Isle.
I would just echo the sentiments that you already heard and the importance of this for our communities, both the university community and our local communities. Both of our institutions are up here in Aroostook County, and even though we're small institutions, good percentage of our students come from across the United States and internationally, and it is just important for those students to be safe in this environment from where they come from, and for us to keep our communities here safe. So this is the best way that we can ensure that the mutual safety of all involved.
Thank you, President Rice. Chancellor, I'd like to take questions if kind of on a first come, first served basis, if that's okay with you.
I thought it was a press conference. We should probably do that.
Transparency. Rachel with the Portland Press Herald has a question or has questions.
Hi. Yeah, I have two questions. So my first question is there something holding up the requirement for the staff, or why would that take a little bit longer?
Well, we have finalized the policy with respect to students. The staff, all of our employees are represented by labor organizations, and will take the moments necessary or the time necessary to explore this. Having said that, we have a very high percentage of our total faculty and staff on a full-time basis already vaccinated, which is different than our student population at the moment. That affords us a little more time to have respectful discussions.
So that was going to be my second question, is what are the vaccination rates right now?
Well, we have over 10,300 individuals of our community who have reported their status to the portal. We are requiring that all students who intend to use a campus or receive a portion of their education on a campus to make a similar report on or before August 20th. That will give us the status of those individuals with respect to the very few who are likely to qualify for an exception based on health or strongly held religious beliefs. And will also tell us which of our students are beginning the vaccine process, and therefore will need to comply for a period of time with some additional regulations around masking and the like. But we don't want to discourage any of our students from starting that process, and that's why we've requested all of our students begin that process prior to August 20th and record that on the portal.
So the 10,300, that's students and staff, or that's just students?
That is students and staff.
Okay.
And that's
All right.
that was without this requirement being in place. So I think that's a very significant number of actual participants, and we suspect that number will rise very rapidly, in part because there are other people who've been vaccinated and simply hadn't reported. And in addition, we are reaching out to students and say, if in fact you begin that process and report it to the porthole and accept minor additional requirements with respect to returning to campus, then you'll be covered under this plan.
Okay, thank you.
Okay, Rachel, I just posted, we had yesterday we had 3,017 faculty and staff as of yesterday's run of the numbers. We're running the numbers, we're tracking them daily. So but that's what we were yesterday of the over 10,000 that the chancellor referenced.
That's sorry, so that faculty and staff number, that's 3,000 out of how many?
That was out of 10,073 yesterday. So now we're over 10,300. I don't have the breakdown yet. But
I think our full-time faculty and staff has a percentage in the 60s already, without a requirement.
Okay. Now, next on the list of questions, Essa from the Bangor Daily News had some questions.
Or from Maine Public, actually.
Oh, I'm sorry. That's right. Yeah, I'm sorry.
No, it's all good. Thank you for doing this. I had a question about masking. Will there be any policy change to the previous masking policy you all had?
Well, yeah, in some sense, this is for some people back to the future, right? With respect to those students who will not have completed, or faculty or staff pending on our discussions with labor organizations. Those students who have not completed their vaccination would be instructed to wear a mask inside buildings until such time as they've completed their vaccination plus 2 weeks. That's why we are urging students in particular to get vaccinated. The J&J means that you would be cleared of those obligations 2 weeks after you actually get that shot. If you opt for Moderna or Pfizer, you have a longer time frame in which you would be wearing a mask on indoor occasions. But what we're saying is, if you intend to be fully vaccinated and so declare and have your first shot by August 20th and record it, then the minor intrusion will be that you'd have to wear a mask until that process is completed, as opposed to others not currently required. I should also say that, you know, this virus is a living thing, and what it's going to throw at us next may at any moment change our response or our rules and regulations with respect to that. But as of the moment, we are not currently requiring in classroom for those who have been vaccinated.
Thank you. And I just had one more question.
Can I just say one thing? We will follow civil authority. We have always followed civil authority. So one sign will be if that civil authority declares that that's a necessity. If that happens, we will follow immediately. If other circumstances present themselves that in our independent judgment require that, then we'll also adjust accordingly.
Thank you. And is there any concern at this point from any backlash or pushback from students who, for whatever reason, are opting not to get vaccinated and don't want to?
Yes. Sure, absolutely. We've heard from a small number of students who say that they will not be vaccinated. As a percentage of our entire audience of students, it is. At least the communications I've had could be counted on two hands. Having said that, and probably less, having said that, we've also been contacted by students who are very concerned that we're not requiring. After all, there are over 640 colleges and universities nationwide that have taken this step. But I think we were particularly moved by how rapidly Delta has taken over Maine and is driving the numbers rapidly higher, even though we're far better off than a Florida or a Missouri or a Texas or a Louisiana. But we don't want to tempt fate. And having a vaccine that has been administered as many times as this one, and knowing that 99.2 to 99.9% of people who do become infected on a breakthrough will not be seriously ill or die is also a reason for us to take additional steps to protect our faculty, staff, students, and their family members, most particularly children who cannot be vaccinated.
Thank you.
Thank you, Chancellor. President Glenn Cummings has joined us from the University of Southern Maine. So I just wanted to say hello and see if President Cummings had anything he wanted to extend to the discussion.
No, I'm sorry that I was late, but if there are any specific questions, I'd be glad to answer them.
Thank you, Glenn. Luca from News Center had a question.
Yeah, just quickly, if you can hear me all right. I understand that a lot of students have already registered for classes for the fall, particularly returning students, and a percentage of those classes, as to be expected for what we knew in the fall, were planned to be online. Will this new vaccination requirement and somewhat elevated level of safety having kids in the classroom mean that some of those classes will go back to being in person, or will that impact students' fall itineraries as of right now?
Well, we have varying amounts of courses available online at each of our universities. Some of our universities specialize in that particular delivery system. That would be UMA, for instance. Others have substantial percentages in the 20 to 25% range of courses being available. Sometimes it's also dependent on whether you're talking about a graduate degree program or an undergraduate degree program. So that I give that to you as a way of background, not as a specific answer. The bottom line is, if you're a student and wish to interact on campus or use a facility, then you need to be vaccinated or in the process of becoming fully vaccinated. Otherwise, your choices would be left to those courses that you could take online, of which there are many in our system. And we will seek to work with students with regard to their continuing their education on a remote basis until such time as COVID disappears or they decide to be vaccinated.
So no status of any current classes will be changed from online to in-person?
There are changes from time to time. So I don't think any changes are being mandated at this time with respect to this announcement. But we have folks who have, someone ill in the family and can't come to campus and therefore wants to teach, with those kinds of things. There is nothing in today's announcement that changes that equation.
And just to add that there are probably some courses where a student who chooses not to be vaccinated can't get the course except in person. And we expect that many of our professors will agree to help out and make that happen. They don't have to, but we expect, given the culture here in the UMaine system, that many of our professors will find a way to help them if that's their only choice.
But you're saying that there might be some classes that are unavailable to students if they choose to refuse to get vaccinated?
Yes.
It's possible. So for example, if somebody is a senior, they need exactly one or two courses that they have to have in order to be able to graduate with that major, then we will try our best to help accommodate that particular student. But again, that's the discretion of the faculty. So we have to be careful ultimately that we don't make a commitment on behalf of the faculty. But I believe, at least from what I've seen across the UMaine system, our faculty will try to help.
And I would just add, those would be program by program decisions that those faculty would make in those situations that President Cummings just described.
Yeah, but I want to be truthful to Luca. Yes, there will be courses that are unavailable to people unless they can access them on campus. That is the reality of the situation we're in. We're not talking about something being permanent. Obviously, the policy itself covers the first semester. Having said that, we have a long ways to go, I suspect, in our battle with the COVID experience.
Understood. And if I can ask just one more question, sort of a follow-up to Estes' question as well. There is sort of like this notion that the vaccine isn't exactly a bubble, but it's more so, right? It's still very much possible to get infected with COVID-19, although rare if you are vaccinated. Is there any thought at all about implementing some sort of like only indoor or some sort of like relative mask mandate even for fully vaccinated students? Or as of right now, as it stands, if you're vaccinated, there is no mask requirement regardless of situation?
Again, we're watching again, we reserve the right to respond to circumstances as they present them. If you're asking whether or not we're announcing that today, the circumstances don't require it at the moment. If they require it, I will assure you we'll respond, and that could very well be on a temporary basis. One of the things we're tracking, and I don't think this will bring relief in the short run, but it may in the course of the semester, is how fast will Delta peak and how fast will it decline. But just to put this in perspective, we are now seeing numbers of infections in Maine that are on par with our early November numbers. We know what happened in the state of Maine and the risk that was taken with respect to ICU beds just a few weeks to 2 months after those numbers experienced by us in November. We don't want to see that again. And it is incumbent upon us, particularly as an importer of students, to make sure that we don't burden the local hospital system. So we're very mindful of that. We will put in protocols as circumstances call for them or as a civil authority so dictates. We've always followed civil authority. Now, having said that, we chart these things just like Maine CDC does. We look at our counties, we look at the advice that's given, and if we see sustained and large numbers in the orange and red color, then we probably will respond. But that's a very different decision than today's decision, and we reserve the right to make those adjustments.
Completely understand. Thank you so much.
I think David was next with the Bangor Daily News, not Maine Public.
Thanks, Dan. Chancellor Molloy, I just wanted to ask a clarifying question. It was my understanding with the last policy that unvaccinated students would, need to wear a mask indoors, and they would also be tested once or twice a week. So just to be clear, unvaccinated students they can't go to campus at all, even if they are tested once or twice a week, even if they wear a mask. They're not allowed to participate in any campus activities under the new policy?
That's correct. And students who are in the process of being vaccinated will, in fact, be engaging in the treatments that you specified, being tested and being masked in circumstances that would not necessarily be required of students who are fully vaccinated. That is a situation that I think recognizes where we are in the timeline and how much time folks have. Now, quite frankly, if you can get the J&J, and that's the one you want, you can be fully vaccinated within 2 weeks of our talking. If you go for what I ended up with, and I didn't choose, I just showed up, and that's what I got, was the Pfizer, which has a longer period of time. And then Moderna has an even a 1 week longer period of time than that. We want to work with those students as long as they're working with us and get that first shot. And agree to live with respect to the regulations that lie before them. And that will be tracked and will be audited. So if you miss taking your test, if you fall into that category and you miss taking that test, your phone will tell you you're no longer in compliance. And if that is not addressed immediately, you will no longer be welcome on the campus.
Great. Many of the system colleges are in more rural areas, which do tend to have higher vaccine hesitancy rates. And any of the university presidents who are on this call can talk to this as well. Do you expect any issues in particularly rural areas? And do you have any strategies to try to get rural students to follow this policy and get vaccinated and go back on campus?
Well, let me just, before I turn it over to those two individuals, Devidine and Ray Rice, let me say that we hope that this is an encouragement to start that process. It is, in fact, designed to be just that. I want to say again, scientists are saying that if you're not vaccinating, Delta is going to find you. Let's just dwell on that. It's 5 times more likely to be transmitted. That's the reality of the situation we're in. We stand at in excess of 615,000 deaths, most of those deaths from a form of COVID that was less likely to be spread and carried lighter loads of the virus in sick people. So this situation has created itself, and we are doing that which is in our power to encourage folks to participate. Ultimately, it's their decision, not ours. Ray, did you want to say something?
Yes, I would just add a good reflection, I think, of that, David, is I'm thinking about my full-time workforce. We're already at 80%. That's up 10% just in a few days. We started a campaign, an incentive campaign that includes, frankly, 3 credit courses that students are eligible for if they posted their vaccination verification, as well as gift cards that can be used for in the bookstore and for the food and the Owl's Nest. So we've also are giving away a prize at the end of the month that goes directly into students' accounts. So we've tried both. We're trying both incentives to help ensure that, and we're continuing that even after this announcement. We're using every leverage we can to help with that. And our student rates just went up to over 30%, 10% already. So, we're already seeing our athletes are almost completely vaccinated at this point, and we're seeing quick movement just in a few days among our students. So that's a good news for that. And we're trying both those methods, the mandate and incentives, to get people to involve themselves in this process.
Before we go to Deb, I just want to correct something. The 5 times number is contained in some studies, although most studies talk about something that is less than that. But based on, I think, the experiences in Cape Cod, it was deemed to be substantially more transmittable than the average 60 to 70%. Deb?
Yes, and we're also using the social media platforms to reach out to students with different TikTok videos on YouTube and using Instagram, et cetera, to reach our students. So we know that that's certainly helping and incentivizing the need to get vaccinated.
Deb also has the dancing Bengal.
I'm sure that would help. Thank you, Chancellor Malloy. I guess just really quick final question. Do you think if there's no Delta variant, if this doesn't spread across the United States, just simply, does this policy change?
This policy change is because of Delta right now. That's, I can look you straight in the eye and say that's the reason. We weren't thinking about this a month ago. And we realize that this is a change. But I will again remind you, we sent everyone home when there was not a single case. And we knew what happened after that. And we're watching Delta. We're well into 3 weeks of watching it heavily, and it's not getting better and it's not getting prettier. It's time to take the steps that we believe are appropriate at this moment.
Thank you.
Arthur with WMTW had a question. If you could take your time asking it so I can find the Deb Hadeen dancing Bengal in my email I'd appreciate it.
Hi, everyone. Thank you for taking my question, and I hope you're having a nice summer. The question I have is, you're going to have those that are saying legally you guys can't do this. So what do you say to those out there that saying you're going against our individual liberties and freedoms? What legal justification can you implement this?
So we have a team of lawyers who've worked on this. We're aware of not only the original decision in the Indiana case, but then a second decision in the Indiana case. We are, to a very large extent, mirroring those decisions. We've also reflected upon the advice from the Justice Department with respect to requiring it. Listen, I think you can find people to challenge it, but the reality is it's been tested. We believe that the steps that we're taking to accommodate individuals are appropriate and are in alignment with court cases.
That's great. I kind of knew the answer, but I wanted you to actually say it. I just, I'm with you guys. I have to play the devil's advocate because I know that there are going to be people that come up to me and say they can't do this and this is why. But I just want to make sure that you had your folks actually say it. So
folks should watch the video of the 39-year-old father of 5 who texted his wife that he should have gotten the profanity vaccine.
Well, speaking for somebody who had it for 3 months and then is a long hauler, and I'm still doing my recovery, I applaud you guys for making this just on a personal level. But again, I wanted to represent people who will call the station and say, hey, legally they can't do it, and why is it that they can do this? That was the genesis of my question.
Understood. And everybody's got a job to do. We certainly understand it. And congratulations on your success in the disease. I think you need to tell that story to more people.
Well, actually, my station did feature me a couple months ago, and it is a long journey. And for those who haven't had it or haven't, have never been or aren't related to somebody who has it, it is no joke. And I wish that message could resonate more.
Well,
go ahead.
Yeah, let me say that, if Dan Demerit was doing his job, he would have showed me the video. So I'm going to have to take this up with him.
Well, just go on WMTW.com and type in long and you'll see my story. But I really appreciate you taking my question, and thank you for all that you guys are doing.
Thanks.
It'll take me a little longer to scrub this video of that joke at my expense before I send it around, but I'll get it up. So that included the questions that we had in the comments. Blake, you said you were all set. With that, Chancellor, final word?
Your number is up on the screen. 2,904 employees have verified. That's 68.6% of our full-time employees.
And counting. It's growing every day.
Do you have that same kind of statistic for the student body, like the exact percentage?
Yeah, we do somewhere. He'll get it for you. I think
Yeah,
it's around. I think it's around 40%. But just remember that's without a requirement, and that's for students who had left by the time we got in the portal business. So you just have to put it in perspective.
Yeah.
Or had largely left by the time we opened up the portal. So that's why these communications. Each of our universities will communicate to their student body and handle the situations that present themselves on their campus. But we will be pushing this literally every single day.
Rachel, you ready for it? It's 1,650 students have verified for the residential population.
Okay.
1,941 are yet to be verified.
1,650 verified.
Of our residential population expected for the fall.
Yep.
1,941 are still to be verified. So that's 45.9%.
Okay. But the vaccine requirement is you don't have to be a residential student. Like you can just be coming onto campus for a class.
Correct.
Okay.
Yep.
Okay.
So we have a ways to go, but again, we're announcing it's a requirement now. We didn't. We asked people to participate. Now it's a requirement if you want to access campuses. Okay. Well,
Blake, if you'll hold on, I'll give you those numbers again once everybody signs off.
Thank you.
Okay.
Thank you, everybody.
Thank you.
Recording stopped.
Blake, you're still with me?
Yes, I am. Can
Okay.
you hear me?
Yeah, I got you. So those numbers are, I stopped recording, so you can make fun of me all you want. So I didn't add them up. I will. The numbers are 1,650 expected residential students have verified their vaccination status.
Hold on. Let me write that. Expected residential have verified. Okay. Okay. And the other?
1941 have not yet. So it's 1,650 out of a expected identified residential population of, I have 3,591 students.
Say that again, that last one.
I added them up and I get 3,591 students have been identified as being part of our in-person population this fall.
Mm-hmm.
And 1,650 of those have already verified their status. So that's 45.9%.
45.9%. And you said that the 3,591, that are expected to be on campus.
Yeah, at this point, we're continuing to build that number for the fall.
Yeah. We'll just say as of today,
Yeah, 45.9% of the student. Yeah, as of today.
Okay, perfect. All right, thank you very much. Appreciate you doing this.
Thank you. Bye-bye.
And Dan, I just had a quick question. Is there a possibility that there could be quite a few students who are vaccinated but haven't yet verified their status yet?
That's absolutely a possibility. So that's a big part of what this message is, and all the campuses, we're seeing we've seen uptakes, increases, but we think there absolutely are students who are vaccinated but have not verified yet. So that's what this is about. We need to have that information in hand, and now it's a requirement. So students will be reaching out to them in all manners to make sure that they get their information, and we'll be having vaccination clinics and things like that on the campuses as we welcome people back. So
great. Okay. Well, thanks as always. Have a good one.
Thank you. Bye.